you going? I said, where are you going? It's noon. Yeah. Without much glare, as much glare. Dallas, are we ready to get ready? Okay. All right. Good afternoon. It's 12:02. This is a Board of Health meeting. Amanda, could you call the roll, please? Here.
Here. Here.
All righty, thanks. So the meeting's being recorded and transmitted, and we are live, so it does not look like we have any members of the public present here, but welcome to any that might be watching. With that, I'll turn it over to you, Dwayne. Whoop. There you go.
Okay. Thank you, Commissioner. Good afternoon, Commissioners, staff members, and citizens of Elbert County. Today I'm going to give an update on activities for the Board of Health. It's going to focus heavily on a COVID-19 update and then a couple other updates. Amazingly, we are 1 year into the pandemic at this point, and it seems in many ways hard to comprehend, but we have experienced a lot of challenges. We will continue to experience some challenges for the next couple months, but there's certainly light at the end of the tunnel, and we look forward to a summer of activities that is hopefully very close to normal. Currently, Elbert County is in level blue, caution on the COVID dial. We transitioned to level blue yesterday. That was preceded by 31 days in level yellow from February 6th through March 8th. And prior to that, we were in level orange since approximately October 12. I'd like to direct your attention to the monitors, where I'll just give a brief look at how we go through accessing daily COVID data. What you're looking at here is the communicable disease portal from CDPHE, and we log on to this every morning, and specifically we're looking at the COVID-19 Colorado case summary, and this is already pulled up, so I'll just scroll down. This gives us a quick visual snapshot of where we are in our 2-week cumulative incidence rate, our 1-week incidence rate, as well as our average positivity for the past 14 days and the past 7 days. Those are rolling calculations and are typically about 2 days behind the cases that we look at every day. That's followed by a graph illustrating the ups and downs, the ebbs and flows of the of the volume of cases. This one goes all the way back to April 1st and through March 1st. And then we can look at detailed case data, including a roll-up summary of the volume of cases. The volume of cases listed here is greater than we are currently counting in Elbert County. Since the inception of the pandemic, we are counting 1,228 cases. That is, as of this morning, a large number of the discrepancy or the difference in those two numbers are cases that are incorrectly assigned to Elbert County, or prior county residents who don't have a current updated address. You'll see 79 hospitalizations, almost 7,500 people tested. That's about, on an estimate of 28,500 county residents, that's about 26, 27% of the population, which is a really good figure. We have not had any deaths since our last report, and we have not had any additional outbreaks since our last report.
That's interesting. The death, if you go back up a little to the deaths among cases, 12, but that next one, 0 death, I mean, is that saying that they aren't attributing any of those directly to COVID, or just?
The 12 deaths represent people that died with COVID, and it's to some degree a little bit of semantics. In, I think, 7 of those cases, they were residents of Good Samaritan in Simla. Certainly they had underlying conditions, comorbidities, things like that. I interpret the deaths due to COVID being someone who was otherwise very healthy, no underlying conditions, and caught COVID and succumbed to it.
Thanks.
And you can see also a graph, a timeline graph of cases reported to the state. Of the residents that have been infected, almost 42% have been age 50 or over, 41.93% to be specific. The gender breakdown is basically 50-50, male and female. Cases have been declining over the last several weeks. We had just 13 cases last week. The previous week we had 26 cases, and for the week ending February 20th, we had 17 cases. So we're trending in a positive direction. Following up on the mention of our move to level blue, there are preliminary discussions underway with CDPHE regarding a dial 3.0. We are currently in dial 2.0. That was, when did we get that? Was that December? But as more people get vaccinated and we can expand the metrics for how counties are classified in each color gradient on the dial, I anticipate we'll move to the working verbiage is dial 3.0. Sometime this spring, that will have a much more heavily influenced local determination of metrics. So it will necessitate a steering committee, for lack of a better term, to convene, and that presumably could be our regular morning steering committee group to come up with those metrics. And my preliminary thoughts on the metrics are, whereas currently, and the most common pressure point is capacity for restaurants. Currently in all color gradients on the dial, there is a 50% capacity. I would probably initially start with a suggestion of increasing that to 66%, 75%, whatever we land on, to provide some additional relief for those capacity restrictions. That would also include things like community events, rodeo. I mentioned rodeo specifically in the context of the Stampede Rodeo, Cowboy Up in Kiowa at the end of June, and so on and so forth.
in the discussion of the 3.0, does that include getting closer to setting some standards to say we're off the dial?
When are we done?
That this is now not background noise, that's probably not the right term, but it's something to continue to be concerned about, but not something to have all life revolve around?
If I understand what you're asking, this will be the last stop before no dial. Does that answer your question?
Yep.
The dial 3.0 would be the next to the last stop. There was a reluctance to transition from the current dial framework to everything's wide open. So this is just another step.
More focused on local control.
Yes.
Ideally,
yes.
we'll all control things well locally, and they can then turn us back to being ourselves again.
As I understand it, and this is in a discussion this morning with the CDPHE, the state will offer guidance, but the ultimate metrics will be at the discretion of local communities, local public health agencies. Transitioning to a vaccine update, the state is currently waiting for the significant increase in federal supply of vaccine. It's anticipated to be another 2 weeks. There are, maybe 2 weeks ago, there was a request for proposals put out by the state to potential contractors that would set up vaccination pods or large-scale drive-through vaccination events. They may award up to 32 contracts statewide. So presumably in the weeks and months to come, people should not have to drive far to get a vaccine. One of the unintended consequences of the current approach to vaccine distribution is that, particularly for rural areas, folks from the metro area are coming to rural areas or driving great distances to get vaccine. And while vaccine is not distributed to individual counties or jurisdictions, in other words, anyone can get a vaccine anywhere. You don't need to be a resident of the county where you get the vaccine. It does put more stress on the supply chain for rural areas that are only getting perhaps 100 doses of vaccine a week or every other week. And in certain areas of the state, vaccine requests are still going unfulfilled due to supply chain issues. Whereas I'm sure everybody's seen these large-scale vaccines in the metro area, vaccine events in the metro area. There is a healthcare agency that is also working on a strategy for homebound folks that otherwise don't have resources to get to a vaccine clinic. We haven't seen too much of that here in Elbert County. A case here, a case there that I'm made aware of, and we're trying to work through those on an as-needed basis. By the end of the week, the state anticipates receiving a vaccine supply of about 250,000 doses each week. By the end of March, that'll increase to 275,000. By mid-April, that'll increase to about 400,000 doses a week. And at full capacity, based on a provider survey, the state anticipates among enrolled providers, vaccine providers, that we can collectively do about 450,000 doses a week. That is anticipating a consistent 70 to 75% uptake of the vaccine. In other words, of the entire state's population, we anticipate nearly 3/4 of people will want and get the vaccine, which is better than, it's been increasing, it's better than initial projections where it was around 40% and then 50%. So I understand a lot of people are waiting for the 1-dose vaccine, which is great. And by the way, people should not be worried about the efficacy of one brand or one pharmaceutical company's vaccine over another. The best vaccine for you is the one that you can get, and the quicker that you can get it. To date, in the county, I'll tell you exactly, 4,353 total doses of vaccine have been administered. Those do include first dose and second doses. That puts Elbert County at 35th among the 64 counties in the state. Most of our residents are getting vaccinated outside the county, and that's evidenced by collectively, as a county, we've only gotten 1,760 doses. So the remaining 2,600 or so doses have been administered outside the county. To date, as of this morning, the Safeway Pharmacy in Elizabeth has received 900 doses. We have administered 560 doses through our partnership with Tri-County Health Department, and Peak Vista has been allocated 200 doses. So those 1,760 doses that have been distributed to the county put us at 50th among the 64 counties in terms of allocation. So how can we improve those numbers? We are currently working through the details of a partnership with Elizabeth Fire Rescue to increase testing opportunities and subsequently vaccine administration. We've got a preliminary contract that's been forwarded to the county attorney for review and consideration. We will use the COVID coordination and response funding to pay for this. The biggest costs are overtime for paramedics that would be administering the vaccine, clerical administration, logistics, things like that, PPE. This will, when it's ready to go, it will occur at Frontier High School in Elizabeth. And once warmer weather gets here, it'll transition to an outside activity.
You said they'd be doing both testing and vaccination? Or?
Yes.
Okay.
So we anticipate that they'll start testing, and this will be using the Binax rapid test in about 2 weeks, depending on where we fall out from the snowstorm that's on the way. I think they had initially hoped to start that next week. That may be delayed a little bit. So I just, out of an abundance of caution, am saying 2 weeks. And then vaccine administration, hopefully within 4 weeks or mid-April. Elizabeth Fire Rescue is in the process of becoming an enrolled provider, which is a somewhat tedious process in getting all your T's crossed and I's dotted with the state. The testing and subsequently vaccinations will start with continuity of local government folks, EMS, and expand from there to include general population. Well, I should say prioritize population on the state vaccination framework, and then general population being otherwise healthy people aged 16 to 59.
Yeah, sounds like a good use of those money resources, but what's the general scope of what's the cost? Are we looking at in that contract? It's
still working through that.
Ballpark?
Perhaps up to $5,000, $6,000 a day, perhaps more. Again, significant upfront costs with getting some supplies and things like that. We are trying to mitigate the total cost using county supplies, tables, chairs, Wi-Fi, hotspots, those types of things, freezer, and I just put an order in for the temperature control module for the cooler that the vaccine goes in, and syringe supplies, things like that.
Okay,
Speaking of funding, again, this will be utilizing an existing award for COVID coordination and response that was awarded last August. All indications continue to point to every local public health agency receiving another base allocation, perhaps $250K, and then a per capita allocation on top of that. Have not heard word as to when that is coming down the pipeline, presumably sometime before summer. I know other LPHAs around the state have run out of their initial funding allocation, and I have had to dip into line item expenditures to continue their progress. Transitioning to what the next couple months look like in the community with spring and summer events. I've been in communication with most of the schools regarding prom, spring sports, graduation. I anticipate those will be at or near normal activities. Certainly any high school graduation that's outdoors, aside from parents and guests physically distancing in the bleachers, it should be a graduation as normal. We are awaiting guidance from the state on considerations for prom, for spring sports, or Season C athletics. The lone remaining indoor sport is volleyball. There will be some typical considerations for that sport, but the outdoor sports for spring, I don't have any concerns about. Community events, I mentioned Elizabeth Stampede. We're in communication with the planning committee at the Stampede. Rodeo will happen. It's just a question of whether or what the capacity is. I would anticipate at a lower end it'll be 50% capacity, at an upper end 75 to 80% capacity for spectators. And the planning committee is doing a really thoughtful job of, for events like concerts, separating people into different areas and different pricing schedule for concert tickets and things like that. We've been in communication with the YMCA leadership for Camp at Peaceful Valley. Again, not any significant challenges there, I don't think. And there's several bike rides, including one that I signed off on that's going through the county, but not, I think they're starting and ending in Douglas County. That is in early June, I believe. I'll pause there. That's the update for COVID-related items, and ask if there's any questions or anything else I can expand upon.
I've asked mine along the way, so.
Okay.
Yeah, I think we're good.
The other public health news or updates, the on-site wastewater treatment systems program is very busy, obviously, as the weather gets warmer and construction ramps up. Stacy and Marissa are plugging away at all the permits and things like that. So the other significant information to share are a couple cases of tuberculosis, not active tuberculosis, through the resources and partnership of El Paso County Public Health, who has a dedicated tuberculosis nurse. They were able to come up to Elbert County to a citizen that had tested positive for tuberculosis. Turns out it is a latent case of tuberculosis, and that basically means that the virus I'm sorry, the bacteria. The person's infected, but is not contagious. So all of those tests have been administered, and it's just in a monitoring phase right now. The second case is continuing to be monitored, and I think at last check, we're coordinating with, again, El Paso Public Health on that one. No other communicable disease updates. It's not yet rabies season. We are trying to make some progress on behavioral health and mental health promotion. I expect that we'll make more progress once we can transition out of COVID and begin our community health assessment, probably late summer, early fall, and get a better understanding of the specific behavioral health concerns and particularly with access and provision of care that residents have. Right now, we're just trying to continue messaging resources through the appropriate behavioral health providers. And as part of that, those resource messaging, a big component of that is destigmatization of mental health, behavioral health issues. And that's all I have.
No, appreciate the update. Glad it looks like we're coming out of this. I know it's been a long year for you and your staff, tremendously, so thank you for that.
Yep, thank you.
So with that, I'd ask for a motion to adjourn the Board of Health meeting.
Mr. Chairman, I move we adjourn the mental health meeting, or public health meeting.
Yeah. I'll second.
Okay, a motion and a second to adjourn the Board of Health meeting. All in favor, please say aye.
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 Aye, motion carries. We're adjourned.